So I think it'd be helpful for people if we talked a little bit about group therapy.
Yes.
Because it's such an amazing way to work on your mental health that's not often taken advantage of by people. You know, you think of individual therapy, but often it doesn't occur to you to go to group therapy, and it can really be so beneficial.
Yeah, a lot of times you're maybe referred to a group due to a specific problem, maybe a
Mhm.
loss or something like that. Or a lot of times people think of group in terms of addiction or recovery. But there are so many other opportunities to engage in group therapy and so many benefits. So we wanted to share some of that information to get that out there in the world.
Yeah, and I think such a huge part of the work that we do centers around human connection, and not just in therapy, but in all of the work that we do, human connection is such a big piece of it. And our whole model is based on human connection. Um, so it can really be so healing.
And a lot of times in individual therapy, there's specific work on a particular issue, but there isn't necessarily an understanding um, of the exact issue that's being dealt with. So when you're in a group, you can kind of have that shared experience and feel validated a little bit more and just have an
Mhm.
opportunity to kind of have a larger support group.
Yeah. So if you don't know what group therapy looks like or what it entails, we can only speak to group therapy the way that we do it. So there's all different ways to do groups. And I don't think the way that we run it is that different than other people. So basically, group therapy, there's usually anywhere from 5 to 12 people in a group. And they can have themes. So you can have a grief group, you can have a group to help people with anxiety, you can have a teen group, you can have a women's group, or it might just be a general support group.
And sometimes groups are formed around a particular type of therapeutic modality. So, for
Mhm.
example, there might be a CBT, which is cognitive behavior therapy group, or a dialectical behavior therapy group. And so there's a lot of variety in that. And we want to kind of explain what it looks like
Mhm.
just so you can have a better understanding.
And there's also sometimes a difference between a support group, a psychoeducational group, and a process group. So a support group is really where people just share. So you share your experiences and you can benefit from learning from each other. A psychotherapy group tends to be where you get a little more in depth. The leaders who are therapists usually are more involved in sort of guiding. And then a psychoeducation group is more skills based. So a lot of times a DBT group, dialectical behavioral therapy, will be skills based. So you'll learn tools and techniques for managing different symptoms.
And so some of the benefits of group therapy, I want to talk about some of that, like why would somebody go to
Yeah.
group therapy
Mhm.
versus individual therapy? And it's really to give this idea of universality. I can't say it.
Universality.
That's it. And really just knowing that you're not alone in the issues that you're struggling with. So many times you feel like you're the only one struggling or carrying a burden,
Yeah.
and having an opportunity to have that understanding and validation from others really can help with the process of healing.
Yeah. To learn that you're not alone in your struggles and to get support from other people who've experienced similar feelings or events. Um, can reduce that sense of isolation that you sometimes get when you're struggling with depression or anxiety or different mental
Mhm.
health issues.
And it can help give you some different perspectives from other people.
Yeah.
That way, you can hear how someone may have taken a different path or a different way of dealing with something and what those outcomes were. So, kind of really giving an opportunity to hear from different people,
Mhm.
learn from other people's experiences who either are maybe further along on their journey and they can kind of give some insight in that respect. And if you're newer, kind of learning from that and kind of sharing where you're at and feeling that connection.
It can also boost your own confidence, um, because you might hear somebody talking and say, well, you know what, I went through that too, and here's what I did, and it really helped. And it feels good to be able to share that with somebody else and to teach them something that they might benefit from, can create really good feelings for yourself.
Something we've heard in terms of some concern about joining a group is confidentiality. Like, how do I go and kind of feel like what's happening for me is going to be kept confidential? Um, and confidentiality works the same way in group therapy that it does in individual therapy. What happens in the group stays in the group. We make that very clear to our participants that it is not something that, you know, they share once they're outside of that group, because we really want to keep that situation, you know, sacred.
Yeah, we really work to create a safe space for people. So it's as much as possible to no judgment zone. The group leaders are there to make sure that everybody communicates respectfully, and in a way that's helpful to just maintain that feeling of safety for all involved so that everybody feels comfortable sharing. And we also never push anybody to share. So you share when you're comfortable, and you share what you're comfortable sharing.
Yeah, and that's something that we, you know, that there's some apprehensive about, well, what if I go and I don't want to talk? You don't need to talk in group therapy. Obviously, that would be a goal to participate and get, you know, you kind of get out what you put in. But it's not something that is required in order for you to be part of a group. You really going there with this idea of sharing when you're ready, building and learning to trust when you're ready for something, and having an opportunity with this confidential group to start to practice some of the skills and techniques that maybe you're working on in individual therapy or that you want to be working on. How you mentioned communication, it's a great place where everyone is working on that, and you can really start to, you know, work on boundaries and how to communicate effectively and be empathetic and take turns, like things that we're hoping that you can then take and use in your everyday life with your family members or your coworkers or anywhere else where that might be something that's a little bit more risky. The group therapy setting is a great place to practice that. That's less risky because everyone has that confidentiality, and the structure of the group allows for that in a more safe place, safe way to do that.
You also might find that you meet some really amazing people that you form relationships with people that you want to spend time with outside of group. Different groups have different rules. So usually if you're in a group in an intensive outpatient program or a PHP program, they discourage you from contacting each other outside of the program for a variety of reasons. But in an outpatient group like the ones that we run, we encourage it. If you find somebody in group that you connect with and you want to spend some time outside the group, that's great. So a lot of times people do make new friends and gather their own support system that they carry on with even after the group has ended.
You know, and one of the other misconceptions about group is that it's for like significant or severe mental health issues. And while that is true in, as you were saying, like a partial hospitalization program or an intensive outpatient, there may be more significant issues being addressed. In an outpatient situation or the types of groups we run, there could be issues of everyday life stressors, transitions. You know, the kinds of groups that we run involve, you know, being stuck in a funk or getting out of feeling kind of down and depressed, or you know, feeling anxious, or you know, groups for, you know, moms struggling with, you know, day-to-day life, or when their children, you know, parenting issues. So it's not, going to group therapy doesn't necessarily equate to it needing to be an extreme situation for you to be in. It's really an opportunity to grow and have support from other people who are struggling with the same things.
There are lots of groups out there. You can Google group therapy near me. You can go on Psychology Today. I believe they have a listing of different groups. We, in the next couple of months, will be offering virtual groups, a women's group and a group for teens. So feel free to log on to the website or reach out to us, dualtherapistmodel.com, if you want more information on that.
Great.
Thank you.